the South African Human Rights Commission is set to visit the Rahima Moosa Hospital in Johannesburg this morning. It's investigating after a doctor exposed the shocking state of the facility. Dr. Tim de Meyer was suspended after writing an open letter to the health department, but after a public outcry, the suspension has been lifted. Our reporter Heidi Giokos is at Rahima Moosa with the latest and joins us now. Good morning, Heidi. We're expecting the Human Rights Commission. How, in fact, is the atmosphere today following the suspension and then the bringing back of the doctor? How are other colleagues actually coping?
Well, we'll find out a little later on, Mfundo. I think we'll definitely get a sense of the kind of environment that these doctors have been subjected to here at Rahima Moosa Hospital. That letter that was written by Dr. Tim de Meyer was scathing, and it spoke about the situation and the environment and the circumstances that many doctors face, especially here in Gauteng province, where we do know that a lot of the hospitals are buckling under because they are just under immense pressure, under-resourced, don't have enough budgets. A lot of what was highlighted in that hospital by, in that letter by Dr. Tim de Meyer highlights the fact that there are many issues that this hospital faces. For example, the fact that when there is load shedding, doctors have to use their mobile torches, their cell phones to continue with surgery because there are no lights. The fact that there are no proper toilet facilities because they don't have running water, and there's a huge problem with the water facility here at Rahima Moosa Hospital. So I think a lot needs to be figured out and sorted out. We are unable to go inside because the security says he needs to first contact his head, his HOD, and then he will let us know if we can go into the hospital. So currently we parked outside, but we've heard time and time again, Mfundo, that there are just too many issues at this hospital. We've heard previously from Action SA, where we've heard how a lot of mothers had been lying on the floor just before they give birth because the hospital is just completely overburdened. So it's going to be crucial for the Human Rights Commission to understand exactly what's going on, but also very important for Gauteng Health to understand these issues and not just suspend individuals because they've decided to go public with the issues here at this hospital or any other hospital.
Because it's honestly discouraging to colleagues now, because in future they'll be scared to raise these issues publicly when there is inadequate facilities, because they've seen that sometimes you might not have public outcry and you'll be quietly suspended and lose your job.
Yes, exactly. So we spoke to the head of pediatrics on Saturday, Professor Ashraf Kovadia, and we asked him about the situation at Rahima Moosa Hospital. Of course, he works very closely with Dr. Tim de Meyer, and we asked him about whether or not he knew about that suspension. We asked him if he was in that meeting that took place on Friday that ultimately saw the suspension of Dr. Tim de Meyer being lifted. And he explained how a lot of doctors at this hospital don't want to give up. They are very good people that work at this hospital, that dedicate their lives every single day to sorting out and making sure that mothers and children are looked after at this hospital. But of course, it is discouraging when you see one of your colleagues being suspended because he was just so tired of being constantly ignored and having had reached out to various various officials within Gauteng and then being ignored. That's why he decided to go public. But of course, Professor Ashraf Kovadia is saying that he is hopeful that things will change and that the environment and the circumstances that doctors and nurses are subjected to here at Rahima Moosa Hospital will change after that meeting. There are also very big concerns, Mfundo, and I think we must say it as it is and state it as it is, that the CEO at Rahima Moosa Hospital is not understanding the circumstances that a lot of the doctors and nurses are subjected to here at this hospital. So again, Gauteng Health needs to come through and explain the situation and explain exactly what is going on and what action is going to be taken. Because at the end of the day, Mfundo, it's the most vulnerable in our society that seek medical care and medical health care from our government facilities. Why this is not being prioritized is a question we've asked a million times. So hopefully that will be sorted out and the Human Rights Commission can play an important role in all of this.
I'm happy that you touch on the somewhat somewhat disconnect between the CEO and the doctors on the ground that are working? Because clearly there must be some sort of disconnect, and one wonders the ease with which this suspension was lifted. Someone then wonders if it wasn't arbitrarily done to begin with, because it can't be so easy to lift a suspension because citizens are now complaining and demanding that you just reinstate somebody. If there were legitimate reasons to suspend, it cannot be so easy as us petitioning or ordinary citizens putting together a petition. So one wonders, Heidi, what could have happened in the first place, or what were the reasons advanced for his suspension if it was so easy to reinstate him?
Exactly, and you wonder why the issues weren't being addressed in the letter that was written by Dr. Tim de Meyer. And instead of addressing the issues, you seem to attack an individual, a doctor that is pleading with you to address the issues, because he clearly states in that very lengthy letter that children are dying because of the state of this hospital. And we have asked the Gauteng Health Department who called for this suspension. We even asked the head of pediatrics, Professor Ashraf Kavadi, on Saturday, who called for the suspension of Dr. Tim de Meyer. And it seems as though nobody really understands where the suspension comes from, because in that meeting it came out that Dr. Tim de Meyer and everybody else within the department, within this hospital rather, was informed just the same time that Dr. Tim de Meyer was, when he received that letter of suspension. Even the reasons for stating for his suspension, people are saying it's not justifiable. You are clearly attacking an individual because he's decided to go public. And why shouldn't he go public, in Fundo? Because the other issue here is this is a public hospital, and a lot of the time the media and a lot of the time people are not honestly told about the states of these hospitals. Yes, there are many issues. Yes, there's budget constraints, there are resource constraints, there aren't qualified doctors or nurses that could perhaps come to this hospital and provide the necessary services. But the doctors that are here are crying out, and for them to go as far as writing a public letter to say we need help, the state of our hospitals are in the worst state ever, one wonders where that suspension comes from, if it was in fact the CEO of this hospital or if it came from Gauteng Health. From what we received from the head of pediatrics, Professor Ashraf Kavadia, he said that from the engagement from the MEC of Health in this province, it seems as though she's open to engagement. She says her door's always open and she's willing to engage with any doctor or any healthcare practitioner in this province should there be a concern. But then everybody's asking, so why was a doctor suspended because of that letter? So there are lots of questions and very few answers, and hopefully we'll be able to get that. But you know, the Gauteng Health Department has not really been forthcoming in terms of actually getting an official on record to explain what truly happened.
No, Heidi, we trust you to get us all the answers. That's our reporter, Heidi Giokos.